My name is Danielle Mueller. I'm here to talk about the skeleton today. We're going to go through all the different bones and different features on the bones, minus the skull, which we covered in a different video. I'm going to start with the foot. You can see the foot here. If we start back here, we have the callus is this bone. The calcaneus here. The talus is here. Then you have the navicular, the cuboid, the three cuneiform bones. Then those are all, as a group, considered the tarsals. When you move from the tarsals up, we have the metatarsals. So you have 5 metatarsal bones right here in the middle of the foot. And then at the end where the toes are, you have the metatarsals. The big toe has only 2 phalanges. So you have the proximal and distal phalange bones in the big toe, but then in the last 4, you have 3 bones. So you have the proximal, middle, and distal phalange in each of these 4 toes here. So that would be the foot. Then we can move to the fibula. The fibula is located in the lower leg. It is the smaller of the 2 lower leg bones. I remember a fib is a little eye, so the fibula is the little bone in the leg. Doesn't really mean anything, but it's easy to remember. You have 2 features on this. When you look at it, it looks pretty similar. The way that this bone sits is going to be the flattened end right here is going to be the lateral malleolus because it's kind of flattened here, and that's down by your ankle. And then the head of the fibula is up, and it makes contact with both the tibia and the femur. So this is the head and the medial or the lateral malleolus. The other lower leg bone is the tibia. So this is the tibia here. You have the medial malleolus here. You have the tibial crest. The bump right here is your tibial tuberosity. Then you have the medial condyle and lateral condyle. And in between where it sticks up right here, that's the intercondylar eminence. When you put the lower leg bones together, you'll see that you have the tibia and the fibula sit right alongside each other. You have medial malleolus here and lateral malleolus here sitting next to each other. So that would be in the lower leg. You have an articulation where the tibia here at the condyles, that's going to articulate with the femur, which is the upper leg bone. So if we bring the femur in, you can see the femur and the tibia articulate there at the knee joint. So this is the femur here. On the femur you can see the head. It's this big ball-like structure right here. Then where it connects to the main part of the bone, this is considered the neck. Then you have kind of 2 bumps that you'll see. The larger bump right here is the greater trochanter, and then the smaller one right here is the lesser trochanter. If we turn the femur back to the anterior view, you can see down here, this kind of like little dip right here, that's going to be the patellar surface. That's where the patella or your kneecap is going to sit. Then as we turn this and look here, we have our lateral condyle here, our medial condyle here, and then to either side of the condyles you have the epicondyles, so this being our lateral condyle, this is our lateral epicondyle on the side, medial condyle, and then the medial epicondyle is right here. If you bring the kneecap in, that patella, that's going to sit right on that patellar surface, so that sits here. So the patella, there's not really any particular feature on this, it's just the patella or the kneecap that's going to be sitting right there on the femur. Then the femur is going to attach to the innominate bone, what we commonly call the hip bone. There are 2 of them that come together with the sacrum in the middle. So when you look at this, you need to be able to tell, right from left. So this part right here is going to point out, and that articular surface right here should be facing forward instead of backwards. This is actually made of 3 separate bones that are fused together. So when you look at the innominate bone, if you put kind of a line right here. Everything above here, this is all considered the ilium. So all this is ilium. Then if we made a kind of a cut right here, coming up right here, this is the pubis or pubic bone right here. And then back in the posterior region is the ischium. So it's 3 bones that are all fused together. There's a couple different features you can see on this bone. So we have it facing forward. So we have our anterior superior spine, the anterior inferior spine, the iliac crest right here. Turn it around to the posterior. You can see the posterior superior spine, the posterior inferior spine. This groove that kind of right here that you see, that's going to be the greater sciatic notch. And then down here, the smaller groove that you're seeing, that's the lesser sciatic notch. If we turn back kind of to the side, you'll see this large hole. This is the largest foramen in the body. That's the obturator foramen here. And then above that, this is the acetabulum. This is where the femur articulates with the innominate bone. So if we take that femur and we place it in there, you can see that ball and socket joint. So that gives you that movement in the leg. And like I said before, this articular surface is going to articulate with the sacrum. So the sacrum is the very last portion of the vertebral column, and you can see that that would fuse right here, and it would sit right like that. So the sacrum will articulate there to make kind of that pelvic region. So if we have this right here and we bring the other one in, it's going to come in to form that pelvic region. And right in between where you see that gap in between the 2 pubic bones there would be a piece of fibrocartilage that would sit right here in between the 2 bones, and that's the pubic symphysis. It's a piece of fibrocartilage that sits there in between, like where that little gap is. When we look more at the sacrum, you can see a bunch of different features. So this is facing anterior here. This side would be the posterior side. Looking at the posterior side, you can see the median sacral crest running right along the middle. You see the sacral hiatus. It's the opening of the sacral canal, because there is, even though in this it's not represented with a hole, if you were looking at an actual bone instead of a plastic one, you would see the hole that runs up in through here and opens right here, because that's where the meninges of the spinal cord are going to run down through there and attach. So you have the sacral hiatus, which is an opening. The sacral canal is right here. These are the superior articular facets that's going to articulate with the last lumbar vertebrae. The holes that you see when you're looking at it from this posterior view, those are going to be the dorsal sacral foramen on this side right here. When you turn it and you're looking at it from the anterior view, instead of calling them the dorsal sacral foramen, now when we have it this way, you're looking at the pelvic sacral foramen. So they're the same holes, but when you look at them from posterior anterior view, they use 2 different names. And then this part right here that kind of juts out, you can see right here, that's the sacral promontory. The very last part here is its own bone. You can see this line that's drawn right here. That is indicating that, all of this is the sacrum. This very last part is the coccyx or tailbone right here, so that's what we see at the very end. But it's its own separate bone. But the sacrum is made of 5 fused vertebrae. If we look at the rest of the vertebrae, we can see some differences. We have 3 different vertebrae. We have lumbar, thoracic, and then we have cervical. So there are 3 types of vertebrae. We'll discuss each type. Some of them have common features, and some of them each have their own individual things that you can see. We'll start at the very top, which is the cervical. The cervical is in the neck region. So when we look at our cervical vertebrae, the first two cervical vertebrae look a little bit different, and when you look at those, you can see these are our top two cervical vertebrae. The top one is known as the atlas, and the second cervical vertebrae is the axis. The atlas has very little body on the actual, where you'd see like the body on all these. You see this large region here. There's no body on the atlas. You can see your superior articular facets. You can see the transverse foramen, the transverse process, and there's not much of a spinous process on this either. So most instructors require you to know that you can identify this as being the first cervical vertebrae and that it is the atlas. The second cervical vertebrae is the axis, and its main distinguishing feature is this little part that sticks up right here. This is the dens, or the odontoid process. It allows basically for your head movement to shake your head no, because it allows for that twisting kind of turning movement that you would not see in the lower spine. So these are the first two cervical vertebrae, and like I said, they look slightly different. This is what a typical cervical vertebrae would look like. So when you look at this, you see the main part here is the body, where my fingers are right here. This is the body. The transverse process are these little pieces that are kind of jutting out to each side. And the thing that distinguishes cervical vertebrae from other vertebrae is this transverse foramen. Neither the lumbar or the thoracic vertebrae have this transverse foramen. That's only the cervical. What attaches the body to those transverse foramen, that's the pedicle. It's kind of this little piece of bone right here and here. Then you have your superior articular facets. The lamina is the bony region right here that attaches, those transverse process to the spinous process. And then when you look at the bottom, so these are your superior articular facets. Then on the bottom, those are your inferior articular facets. And those articular facets are where one vertebrae would articulate with the neck. So if you put two of these together, you can see that the inferior articular facet of the top vertebrae will articulate with the superior articular facet of the vertebrae below it. So that's where you have that articulation or movement. Sitting in between the body of each vertebrae would be the vertebral disc, which is a piece of fibrocartilage that would sit right in there and kind of cushion and act as a shock absorber for the vertebrae. So that was your cervical. Now we're going to move to the thoracic. So you can see as you move down in the spinal column, this obviously gets bigger because the cervical was here, so the thoracic is much larger. It has some of the same common features. You see that body again. You have the pedicle is, the region right in here. You have the transverse processes, the lamina right here, and the spinous process coming off. You also see the vertebral foramen. That's where the spinal cord travels through right there. On your thoracic vertebrae, they have a little spot right here and then right here and here on the vertebrae, and that's where you have the costal facets, and it's basically where the ribs are going to articulate, because the ribs articulate with your thoracic vertebrae. Then as you move to the lumbar vertebrae, these are by far the largest. You can see the very big size difference. So the body on these is very large, very noticeable. You have the pedicle right here, the transverse process on each side, the lamina right here, and the spinous process. You can still see the superior and inferior articular facets on that. There's no distinguishing mark on the lumbar vertebrae like we saw on the thoracic and the cervical. So it's really big. That's its kind of claim to fame there. And when you look at them, some people, like especially with the thoracic and the lumbar, they say that the lumbar looks kind of like a moose, like here's the antlers here, so it has big branching antlers, whereas the thoracic looks more like a giraffe with his ears sticking out here and those little ossicones coming up off of his head and a long nose. So that sometimes helps people look at them and be able to decide, ooh, does this look like thoracic or lumbar? You know, if they're having a hard time, like if you had the last thoracic and the first lumbar, that can kind of help you distinguish between those. So those are the 3 different kinds of vertebrae that you'll see when you look at the spinal column. Then as we move to the arm, the large upper arm bone would be the humerus. So with the humerus, you can see the head of the humerus here. That's going to be what articulates, and allows for movement of the arm. Much like the femur, it has 2 bumps on it. These are, you have the greater tubercle here and the lesser tubercle here. So you have head, greater tubercle, lesser tubercle. You'll also notice that on the humerus, you get this very rough bone, like portion of the bone right here. If you feel the bone, like if you actually run your fingers over it right here, it feels kind of like bumpy, and this is where the deltoid muscle attaches. So this is the deltoid tuberosity right here. It's this rough region that you see on the humerus. As you move down to the distal part of the humerus, you can see this fossa right here. This is the coronoid fossa. Then you have the trochlea is kind of this spool-shaped region right here. The capitulum is the rounded part right here. Then you have your medial epicondyle and the lateral epicondyle on the humerus. As we turn it to the posterior side, we can see the olecranon fossa here. And this is going to be where the ulna is going to articulate. So if we bring the ulna, bring that in, you can see the ulna is going to articulate right here. So this is the ulna. I remember the ulna, it has a U for ulna right here, so that helps you remember the bone. Just like where, since this articulated here, this was our olecranon fossa, this is the olecranon process, because they are going to articulate together. Then you have the semilunar notch or trochlear notch, it goes by both names here, and then the coronoid process goes into that coronoid fossa. So the names do kind of mean something and help you remember what's there. Then this little kind of depression or dip that's right here, that's going to be the radial notch right there. That's where the radial head is going to articulate. The head on the ulna is the lower part that's near the wrist region. So this is the head, and the little piece of bone that sticks out right here, that's the styloid process. If we bring in the radius is going to sit like this. So the radius articulates right here. It sits in that radial notch. So we have the head of the radius is kind of this disc-shaped region right here. Under that is the neck. Then the big bump that you're seeing right here, this is the radial tuberosity. As we move down, we also see the styloid process of the radius, and this also has that little depression or groove right here. That's going to be the ulnar notch. That's when it articulates with the ulna down there. So that's the ulnar notch on the radius. Then we have the hand. So when we look at the hand, we have this set of bones right here are considered the carpals, kind of in that wrist region. Each bone has its own individual name. So you have the scaphoid, the lunate, the tricuetum, the pisiform, the hamate, the capitate, the trapezoid, and the trapezium. I remember so long to pinky, here comes the thumb. So that helps, keep them in order because they all look kind of the same and they're all very small. So that little mnemonic can help you remember which ones are which. As you move from the carpal region, for more distal, you will see the metacarpals here. So you have 5 metacarpals, and then the main part up here, your fingers and thumb, are the phalanges again. So just like in the foot, the thumb, similar to the big toe, has only the proximal and distal phalange, whereas the 4 fingers have 3 phalange bones. You have the proximal, the middle, and the distal phalange in each of the 4 fingers. The last part of that upper extremity would be the scapula or shoulder blade here. So this is your scapula. It's going to, it's located on the back. It would sit like this right here on the back. So when you look at the scapula, you can see this very prominent structure right here. That's the spine of the scapula, which as you follow the spine up, you get the acromion process. As we turn it here, we see the glenoid fossa, and then you have the coracoid process right here. Then you have the straight part is considered the superior border. This part right here is the vertebral border, and this part right here is considered the axial border because this is going to face the axial or armpit region right here. This is going to be the vertebral border because it faces the vertebrae of the spine. Then you have where you have that glenoid fossa or cavity there, that's where the head of your humerus is going to articulate. So that allows for that arm movement there. So you'll have to know right and left. I always tell people, if you think about it, this flat part right here is going to be facing the rib cage right here. The spine has to go out posterior, and then where that glenoid cavity or fossa is, that has to be on the lateral side. So you don't want this facing into your rib cage or into the spine, because then your arm would be coming out of the middle of your back. So this would be a left scapula. So just kind of think about the placement. During a test, most instructors allow you to pick them up. So I would, pick it up if you need to, put it there and go, okay, that's going to be left. So a lot of times you do have to know which direction they're, which side of the body they're on. The last couple bones we're going to talk about don't have a lot of particular features on them. They're fairly basic. So this part right here is the sternum. It's composed of 3 different regions. You have the manubrium is the top portion, so you can see this line right here. This is the manubrium. This is the body of the sternum. And then the little part right here is the xiphoid process. All this kind of tan structure that's coming off is the costal cartilage that's going to attach to the ribs. So when you see one of the ribs here, like this right here is a rib on here, this, where you can see that really blunt end right here, that's going to attach to a piece of that costal cartilage and then wrap around to make that rib cage. And then you'll see some of those articular facets back here where it's going to articulate with those thoracic vertebrae. So this is a rib. And then you have smaller ribs. Like on this one, you'll notice this had that very blunt end because it was this is either a true or a false rib because it's attaching to that costal cartilage. You have a few ribs at the very bottom that do not attach to the cartilage, and so they don't have that really blunt end. This would be a floating rib because it has no attachment to the sternum. Then you have the clavicle or collarbone. So this is going to sit like this. The distinguishing features here are the sternal end, because this is going to attach into the sternum. So this is the sternal end. And then over here, this kind of flattened end, that's the acromial end, because it goes and is very close to that acromion process on the scapula. The last bone, which really doesn't have a direct connection, it's all attached by musculature, is the hyoid bone. The hyoid bone is up in upper throat region up here. So this is kind of like a little horseshoe shaped bone with the little nubs right here. So it looks pretty different than most of any of the other bones. This is the hyoid bone. And that is the bones of the skeleton and the features that you would see. There are probably some features that I didn't cover, but those are in general the ones that they cover in the A&P courses that are here at St. Charles Community College. Thank you.